let's underscore that warning, especially for those who do have respiratory issues.
Yeah, the effects of the smoke can also mimic some of the symptoms of COVID-19. News 3's Denise Rosh is live with more on that part of the story.
Yeah, the advice I heard today, when in doubt, go ahead and get tested for COVID-19. Again, our bad air quality, especially difficult for people with those certain pre-existing conditions. But right now, in the middle of an ongoing pandemic, sometimes it's hard to tell the difference.
I think it's horrible right now.
Lee Schults says it's definitely something he's noticed.
A little in my nose, throat.
Here at Sunset Park, playing a game of disc golf on yet another smoky day. Pollutants from California wildfires still burning out of control.
But besides that, it sucks. There's no two ways about it. It stinks.
And the question becomes, what is all that haze doing to our health? Dr. Kush Modi is a pulmonologist with the Kirk Kerkorian School of Medicine at UNLV.
What happens with these pollutants, it causes inflammation in your lungs, and that causes problems with people who have asthma and COPD, but COVID does the same thing. It also causes inflammation in your lungs, so there is overlap there.
Buddy says patients with COVID will often experience other symptoms as well, such as fever and headaches. If you're unsure, he says, get tested.
And we don't know yet, there is no data out there, but does having exposure to poor air quality make you higher risk of having COVID? I wouldn't be surprised if it does so, but we don't have any data to back it up.
Much of the smoke is blowing south from the Calder Fire in El Dorado County, California. It started August 14th, burning 183 square miles as of Tuesday afternoon, and now moving dangerously close to Lake Tahoe. Just take a look at the air around Reno. Heavy smoke affecting at least one high school football game in the region. Bishop Manogue High School tweeting out, due to the smoke, our team has been unable to practice. Friday's game against Bishop Gorman has been canceled. One tip from Dr. Modi.
Hopefully you have proper filters at home with your HVAC system, which can clear most of these pollutants. Not all of them, of course, but it does clear most of them. So that would be the advice I would give to my patients.
Back at Sunset Park.
Only a couple times in my life this bad here.
Schultz says the smoke won't chase him inside yet, but that view, hardly a picture-perfect day in Las Vegas. Now, the doctor also tells me that life expectancy actually goes down in people who are exposed to bad air over a period of time, but that means exposure over years, not just weeks or days. Still, it is recommended that you avoid strenuous outdoor activity until our air clears up.
Now, speaking of COVID, the Clark County School District may look at mandating vaccines. That's a big talker. That's one nugget we got from the superintendent of schools today, who sat down with our Jeff Gillen. Hi, Jeff.
Good to see both of you, Las Vegas. Good evening, everybody. Vaccines were one issue we talked about. We also talked about how well prepared students were to start learning again after months of online instruction. Was last year a lost academic year for the 300,000 plus students in the nation's fifth biggest school system? Not for everybody, Superintendent Jesus Jara tells me. Some kids did well, others not so much.
We were expecting, and now once we received the full data for this fall diagnostic, that we're going to have a lot of catching up to do.
Jara tells me testing going on now will give the district a better picture of how well kids learned last year, which became a year of online instruction.
When you look at it, you know we've lost, because there's nothing that's going to replace an excellent teacher.
COVID, of course, remains in the background. A stronger version of the virus is spreading quickly. The latest numbers from the district show 865 positive COVID cases, 247 school staff, 171 central staff, and 447 students.
How safe are your schools right now, do you think?
Our schools are extremely safe.
Jara tells me the school's mitigation strategies are working. Critics say enforcement is uneven. Jara says to fight that, he's working closely with health officials.
366 schools and 366 principals. This is why we had the Southern Nevada Health District meet with all our principals.
Those meetings are ongoing, Jara tells me. Masks are required of both students and staff. What about vaccines, now that the FDA has approved the first COVID vaccine from Pfizer?
Are you thinking of doing that?
It's a conversation I need to have with the board of trustees. We need to have, that discussion of where we're going to be. So this is a conversation we need to have. to make sure that our kids are safe and our teachers are safe as well.
Jara tells me he hopes the recent surge of COVID doesn't get worse.
It's taking a toll on everybody.
Not only on students and their families, but CCSD staff as well. His co-workers are exhausted, he says. Last week, he tells me, 8 school nurses quit. And we also talked about school buses. Some kids are waiting a long time to get picked up. Jara says there are 240 bus driver vacancies. He says he's meeting with our bus system, the RTC, tomorrow to see if they can help out.
Well, you know, for the past year and a half, we've all closely followed the cost of the COVID-19 pandemic on families and human lives.
And tonight we're getting a much better look as well as the financial impact here. News 3 Steve Wolford is live in the newsroom with some staggering numbers, Steve.
Yeah, there's some big ones. This new study comes from the Kaiser Family Foundation, which analyzes data from hospitals. It deals with what it calls the cost of preventable COVID-19 hospitalizations.
In June and July, we estimated that over 100,000 hospitalizations for COVID were preventable with vaccination.
A sobering number from Kritika Amin, who co-authored the report from the Kaiser Family Foundation. And she says it translates into a staggering hospital bill.
We estimate that the preventable COVID hospitalizations may have cost over $2 billion in June and July of this year alone.
That's based on an average hospital bill of $20,000 using data from Medicare and private employers, and consistent with the cost associated with pneumonia care before the pandemic. And the Kaiser Family Foundation report indicates slightly more than 98% of all COVID patients hospitalized in June and July were unvaccinated.
It is extremely costly, any COVID hospitalization.
Brian Clevin, CFO for Dignity Health St. Rose Hospitals, says treating someone hospitalized with COVID is expensive because it requires so many resources.
Those patients are requiring pharmaceuticals that are very expensive, such as remdesivir, many of those that you've heard, along with also the life-saving treatment that we're providing is very costly.
But what does this all mean in the long run on your health insurance rates?
Because of COVID, a lot of people have also been avoiding hospitals during COVID. And so utilization and spending has actually been down for insurance companies.
In other words, Amin says insurance companies avoided many other payouts they might have made before the pandemic.
In our initial review of rates, what we'd found is that insurance companies are saying that rates will increase moderately, and the COVID impact is basically flat.
Amin says the elective procedures have pretty much rebounded since the beginning of the year, but still haven't made up for all those missed visits that occurred during the pandemic.
Hi everybody, I'm Reed Cowan from News 3 Las Vegas. We want to thank you for checking out our YouTube channel. Remember, you can always see more of our videos by clicking on the video links. And also don't forget to click that subscribe button so that you don't miss out on any of our YouTube updates. Thanks for watching.